Hi everybody. I'm so glad to be here and so fortunate that I have this opportunity to reconnect with everybody. I know everyone's going through a hard time right now, but we've just got to make the best of our situation. Unfortunately, everybody is in the same situation, but this is awesome that I get to connect with you guys and teach you again. Yay! I miss everybody. I hope you miss me. I know you do. We've got a few people that have connected. Not everybody's on, but hopefully eventually everyone will join in. So the plan for today is we are going to be talking about Botox and laser. So if you want to get out your Botox chapter and your laser chapter, that would be great, and you can follow along with me as I read. I'll elaborate on all the important things as I usually do and go over what you need to know for quizzes and tests. This week, Botox laser chapters and questions, and then you are going to be required to do one quiz, and that will be your cosmetic surgery quiz. Okay, so at the end of the chapters, I'll review the cosmetic surgery quiz information. I believe you guys went through that with Allie when I was away that one day, so we'll review that. So let's start with Botox. Oh, good, can you hear me? Awesome. And then we'll talk about all the question answers at the end. Try to keep your questions based on what we're learning and talking about. Any questions about student loans or schedules or class times can be directed to student services, okay? So Botox, you need to know that Botox is botulinum toxin type A. So botulinum toxin type A is basically cosmetic Botox. You need to know that it is a protein complex produced by the bacterium Clostridium botulinum, which contains the same toxin that causes food poisoning. So no, you're not going to get food poisoning if you inject your face with Botox, but it does come from that same bacterium, okay? When used in a medical setting as an injectable form of sterile purified botulinum toxin, small doses block the release of a chemical called acetylcholine by nerve cells that signal muscle contraction. So you never want to say that Botox freezes the muscle or paralyzes the muscle. I mean, I guess you could compare it to that, but that's not what's actually happening. Botox stops the chemical messenger. So you have your muscle, you have your nerves, and your nerves relay messages. So those little messengers are called acetylcholine messengers. So whenever you get a signal, the acetylcholine messengers go over, they touch the muscle, and they tell your muscle to smile or to cough or to frown or do whatever. When you block those chemical messengers, that message can't get to the muscle, so the muscle doesn't react. So that's why most people, when we make fun of people that get too much Botox, they look really stoic, they have no facial expression because their muscles aren't moving. The downside to that is with people that overdo it is that when you're not moving your muscles, I'm talking right now, I'm exercising my muscles, it's actually keeping them firm. So when your muscles aren't moving, they get slack, they get loose. So you don't want to overdo your Botox. So you will need to know all of that for your Botox quiz. The name for cosmetic Botox, botulinum toxin type A. And guys, if while we're reading through, if you're not understanding something or you're not getting something, again, we're going to do question answers at the end of the chapter, but we're also going to be doing a Zoom tomorrow. So if you have any questions for me tomorrow, you have a chance. You have a platform to ask then too, okay? And of course, we can always communicate via email and our Facebook private group chat. By selectively interfering with the underlying muscle's ability to contract, existing frown lines are smoothed out and in most cases are nearly invisible in a week. So if you stop making that facial expression, then obviously those lines are going to soften over time. Okay? Botox injections are the fastest growing cosmetic procedure in the industry and is regulated by some as the ultimate fountain of youth. Botox was first approved in 1989, highlight that, you need to know that for your quiz, to treat two muscle disorders, uncontrollable blinking, known as blepharospasm, and misaligned eyes, known as strabismus. Yes, you need to know the other name for misaligned eyes and uncontrollable blinking. Blepharospasm and strabismus. And that happened in 1989. You need to know that. In 2000, the toxin was approved to treat a neurological movement disorder that causes severe neck and shoulder contractions, known as cervical dystonia. So the contractions, uncontrollable contractions of the neck, they were using Botox to stop that. They were using Botox to treat these eye disorders, misaligned eyes, uncontrollable blinking, and they found that these clients were starting to look younger. And so they put two and two together and realized that they could probably get this approved for cosmetic use. So that happened in 2002, so not long after they were using this for medical issues and disorders. So you need to know in 2002, cosmetic Botox was approved. The FDA was satisfied with its findings, indicating that Botox could reduce the severity of frown lines for up to 120 days, so 3 to 4 months. The agency then granted approval to use the drug for this condition. Careful deliberation, investigation, and evaluation was undertaken by the agency before any prescription product was approved. So drugs such as Botox, which are not indicated for serious or life-threatening conditions, are subject to a greater level of scrutiny because of the benefit to risk ratio. So this means that the FDA may allow someone to incur a greater risk from products that treat medical conditions rather than those that are approved for cosmetic purposes. So basically, when you see these drugs being marketed in commercials or online for medical purposes, they have a lot of side effects that come along with them. Nausea, diarrhea, blurred vision, sometimes death is a side effect, but it's treating a deeper underlying issue, health issue that this person is suffering from. So obviously the FDA is not going to approve Botox if there's side effects like diarrhea and nausea. There are absolutely no side effects from using Botox if it's used properly, okay? So that's why it was approved. The recent rise in popularity of Botox has much to do with the manner in which it is frequently marketed. Some practitioners buy the toxin in bulk and arrange to have get-togethers for people receiving their treatments. So Botox parties are really popular. Lots of people get together. The doctor will go to the house of the person, or they'll go to a clinic, and like-minded friends will get together, and they'll all get their Botox together and support each other. And when they do that, they usually get a discount from the doctor administering the Botox. Botox is licensed for marketing and distribution as single-use vials. This means that as packaged, each vial is intended to be used for a single patient in a single treatment session. Botox does not contain a preservative against potential contamination of the product through repeated use of a single vial. Once opened and diluted, mixed with a solution, Botox must be used within 4 hours. Treating multiple people with one vial violates product labeling, which is stated on the package insert, the vial, and the carton. Botox is preserved in freezing temperatures, usually on dry ice, in small vials, in freeze-dried powder form. So Botox actually looks like a white dry powder, and then when they mix it with the serum, it turns into a liquid, and that's the injectable form of Botox. It needs to be reconstituted into a liquid prior to injection. So this liquid is a sterile salt water. So we talked about this before, saline solution. Saline solutions are a natural form of salt water that the body can naturally absorb and process. This is the conventional standard and recommended method for Botox preparation. Each 1 ml of this dilution contains 40 units of Botox and has been proven to be the most effective way of preparation for cosmetic uses. Although the manufacturers recommend that they consider to be optimal dilutions, different physicians use dilutions that work best for them. So basically the physicians can choose how they want to mix their doses for their clients. The dilution factor depends on where we are using it on the body or on the face. For example, when used in the underarms to treat excessive sweating, hyperhidrosis, it is more diluted than when it is mixed for treating facial lines. So yes, you can use Botox in other parts of the body, not just the face. You can use Botox to treat medical conditions as well, like hyperhidrosis, excessive sweating. So they actually will inject directly into the sweat gland, and the sweat gland won't get the message to produce sweat. That is an expensive form of treating hyperhidrosis. There are lots of other ways that I'll discuss later, but I do know of a few people that are using Botox to treat that condition, and it works for them. Sweaty palms as well. You can have Botox injected into your hands for sweaty palms. I know a lot of actors actually do that. The FDA is concerned that Botox has the potential for being abused. Like any drug, if it gets into the hands of the wrong person, then you can run into complications or unsanitary environments, infections. Unqualified people are dispensing Botox in salons, gyms, hotel rooms, home-based offices, and other retail venues. In such cases, people run the risk of improper technique, inappropriate dosages, and unsanitary conditions. Botox is a prescription drug that should be administered by a qualified physician in an appropriate medical setting. So as an esthetician, we legally can't administer Botox injections, but we can definitely work alongside a doctor in a medi-spa or a clinic and treat pre-op and post-operative measures with clients, prepping the skin beforehand, finding out about any contraindications, and then treating the skin afterward with the appropriate skincare products at home. Many physicians do not allow their staff to administer Botox. Even the most skilled healthcare providers can have complications as well as dissatisfied customers. Although there is no chance of contracting botulism from Botox injections, there are some risks associated with the procedure. So if too much Botox is injected, for example, or if it is injected into the wrong facial area, a person can end up with a droopy eyelid known as ptosis. So you guys learned about ptosis in the cosmetic surgery chapter. You can have droopy breasts, which means ptosis. You can have a droopy eyelid, that also is ptosis. And this can last up to 2 to 3 weeks. This particular complication was observed in clinical trials. You do need to know on your test what a droopy eyelid is, so highlight that. Other common side effects following injections were, highlight this, headache, respiratory infection, flu syndrome, nausea. Less frequent adverse reactions include pain in the face, redness at the injection site, and muscle weakness. These reactions were generally temporary but could last several months. While the effects of Botox cosmetic don't last, people don't seem to mind repeating the procedure every 4 to 6 months in order to maintain a wrinkle-free look with very little recovery time. So you need to know that you can't inject Botox any sooner than every 3 months. If you do that, you run the risk of the product saturating into other parts of the body, Worst case scenario, I heard this, it happened in the States years ago, but people get obsessed with procedures, cosmetic procedures, injections, and they overdo it. And even though the physician isn't allowed to administer the treatment, they somehow still get around that. And what happened to this one lady was she was injecting her face, and she was doing it way too frequently, and it started seeping into her lungs. And she actually stopped breathing. She couldn't breathe because the acetylcholine messengers that are telling the lungs to expand and contract, it wasn't working. So yeah, she died. But that's the only story I know. And that probably happened in the very beginning, probably 2002, 2003. But you don't hear about stories like that very often with this procedure. It just doesn't happen. Okay, so that's pretty much a short chapter. I'm going to go over the questions with you guys. So the questions aren't right behind that exact chapter. They're at the very back of all the kind of cosmetic surgery modalities. So if you go back past laser, past stretch marks, past vein therapy, you're going to see the questions right after your cosmetic surgery questions. Okay? So Botox. And these are the questions you're going to need to know for your quiz. Okay? What is Botox and how does it work? It's a protein complex produced by the bacterium Clostridium botulinum. And how does it work? It blocks the release of the acetylcholine, preventing muscle contraction. Okay? What was Botox first approved for in 1989 and then in 2000? Um, 1989, uncontrollable blinking, known as blepharospasm, and misaligned eyes, known as strabismus. In 2000, it was approved for cervical dystonia, which is uncontrollable neck contractions. What happened in 2002, April 2002? The FDA approved Botox for cosmetic use. What does the benefit to risk ratio mean? It means that the FDA will allow someone to incur a greater risk to treat medical conditions rather than cosmetic conditions. Number 5, can you use the same vial of Botox on more than one person after opening? How long do you have to use it? Again, once the vial has been mixed, it has to be used within hours. So the practitioner will always mix the exact amount that they need based on how many units the client wants injected. Why would the FDA be concerned that Botox is being abused? The FDA is concerned about Botox being abused because it's getting into the hands of wrong people. It can only legally be administered by doctors in Canada, and unqualified nurses, estheticians, physiotherapists are getting their hands on it and offering this service to their clients. So it needs to be regulated and monitored, and it's not completely. So the FDA does have a concern about that, as well as where it's being injected. Like if it's being injected in gyms or people's homes or certain offices that aren't sanitary, then obviously you're going to run the risk of infection. What are some risks and side effects associated with Botox injections? Swelling, redness, muscle weakness, ptotic eye, droopy eye, headache, and nausea. And again, these side effects are not very common at all. How often is it recommended to repeat Botox treatments for maintaining a wrinkle-free look? You should repeat treatment every 4 to 6 months, no more than every 3 months. Okay, you'll need to know that for your quiz. Now, for your quiz, you're also going to need to know how Botox treats hyperhidrosis. So we talked about how hyperhidrosis is excessive sweating. It can be on the palms, it can be on the feet, it can be anywhere on the body, usually the underarms. So you do have to explain it the same way you would how does Botox work anywhere else on the body. It blocks the release of acetylcholine, which is the chemical messenger, which tells, instead of saying the muscle to contract, you're going to say blocks the release of acetylcholine chemical messengers that makes the sweat gland contract or excrete. Okay, so same thing, just instead of muscle, you're going to say gland. Name 2 types of hyperhidrosis and possible treatments used to treat the condition. So 2 types of hyperhidrosis are primary and secondary. You don't have this information in your manual, so I'm either going to send it to you in our Facebook chat, or Anna will send you the information in your folders on the drive. So we'll do that today at some point. Primary hyperhidrosis is of unknown cause and usually happens in adolescence or puberty. I actually had primary hyperhidrosis, I think when I was 16, maybe 15. And I had like major excessive sweating. I would like make sweat rings in my shirts all the time. I'm not proud of that. So there are options aside from Botox injections. You can get high octane antiperspirants. So it's basically an antiperspirant made of alcohol, and you dab it on, and over time, probably after 2 weeks, it completely dries out the sweat gland. It doesn't produce sweat anymore. So there are other options for that. So primary, you need to know adolescence, puberty, high octane antiperspirants containing aluminum chloride. For primary, you can use iontophoresis, so electrotherapy is used to treat that as well, and of course Botox. Secondary hyperhidrosis, you need to know, is less common and usually caused by underlying issues. So hormonal issues like menopause, pregnancy, hyperthyroidism, so if you have a thyroid gland issue, obesity, cancer, there's lots of degenerative diseases that will cause excessive sweating. So that's secondary, okay? So you do need to know the differences between primary and secondary on your quiz. And that's it. Okay, so we're gonna open it up for questions now before we move on to laser. I hope you guys have questions for me. How to do Botox. Isa, hello. Will we be learning how to do Botox? I wish. No, it's not legal for estheticians to administer Botox. You learn about the procedure and you learn the theory behind it, but we won't be injecting each other. The age most people do Botox, oh my goodness, well, as young as 16. Legally, I don't think you can have injections until you're 18, but it's a very common thing to get now. Not only are people using Botox to decrease wrinkles and furrows and lines, they're using it to actually reshape their face. So you can inject Botox into your chin to give a pointier looking or more pronounced looking chin. You can inject Botox into your cheekbones to give yourself a higher cheekbone jawline. So you can actually change the shape of your face. So I would say 18 plus. And it's preventative too. So a lot of younger people are doing Botox at a younger age to prevent the lines from forming, because if you can prevent that frowning or squinting or laugh lines, then you're not going to form those creases and furrows. So it is very preventative as well. How many people, how can you tell how many people are on? We've got Isa.
Are you asking me?
Yeah.
We got 12 people.
12 people? More questions, please. I know you have more questions for me. A few more minutes and we'll move on. Hi, Suki. Okay, well, moving along. I know you guys will have questions about this again. So no manual on hand. Okay, that's no problem. You guys can work on your questions at your own time tonight or tomorrow. I'd like you to have your questions done by tomorrow's Zoom. We're doing Zoom for questions and answers at 12 o'clock. So try to finish them tonight if you can. Recorded the part if the questions and sending it to the group. Yeah, I'm going to send all the answers. I can send the answers to you guys so you know exactly what you need to know for your quizzes and tests. But I'm only going to do that if everyone's completed the questions. So you guys have the questions, and then me and Anna have access to them in your folders, in your individual folders. So just make sure you complete everything, and then I can send you guys the information. So you guys, the only quiz you have to do this week is the cosmetic surgery quiz. I just want to do a bit of review on that before we move on to laser. They can also send it by email directly, yeah. Perfect, so you guys can send your question answers via email as well. Actually, that's what Taya did. She's sending all her work via email, so whatever is easiest for you guys. Okay, so cosmetic surgery quiz. You guys basically are going to have the name of the surgery on one side and then the medical term or name for that surgery, and you just have to match, okay? So hair replacement surgery is filling in balding areas with clients' own hair from a different part of the body. Male breast reduction is known as gynecomastia. A breast lift is mastopexy. Collagen plumps up creased or furrowed facial skin. Facial implants, the use of implants to change the basic shape of the face. So implants are basically these tiny little silicone pockets. So they'll put a little incision in the chin, they'll push the little silicone pocket in, so you back up, and then you have that contour for the face. So it's basically used a lot for symmetry of the face. If you have a nose job and your nose is a lot thinner and pointier, to make the face more symmetrical, they'll put implants in. So they might, usually what goes along with a nose job, rhinoplasty, is a chin implant. The thinner your nose is, you want to have more of a tip on your chin so it's symmetrical. As well as cheek implants. Men are getting implants a lot now for making their face look more masculine, which is crazy, but hey, if you can do it, why not? I knew a guy who had this done. He actually had implants put in his jaw, so he had more of a square jaw, in his cheeks and his forehead, because I guess when men have a more pronounced forehead, it makes them look more masculine. Obviously, we've heard that people are getting implants in their muscles, in their stomach muscles to give more contour. Those are the excessive cases, but yeah, you can put implants pretty much anywhere. You need to know that nose surgery is rhinoplasty. Breast enlargements are called augmentation mammoplasty. Tummy tuck is abdominoplasty. Chemical peel is known as a TCA peel. Eyelid surgery is blepharoplasty. A facelift is rhytidectomy. A forehead lift minimizes forehead creases. A forehead lift can also raise the eyes. So when women get older and men get older, their eyelids kind of droop over. And they lose that crease, that eyelid crease. So when you have a forehead lift, it actually can lift all of this up as well. Instead of having like an eye lift, you can just have a forehead lift and it will give a natural lift to the eyelid. Forehead lift, ear surgery. Ear surgery is known as otoplasty. Liposuction, suction-assisted lipectomy. So those are all the terms that you need to know on your quiz. You also need to describe what preoperative and postoperative means. So in regards to any surgery, preoperative, before, means procedures that need to be done before surgery. So sometimes that will be fasting, not being able to eat solid food, drinking lots of water, maybe using certain serums on the skin to prep the skin before surgery, and then post-operative, post-surgery, things you have to do afterwards. So changing bandages, antiseptics, serums or creams to heal the skin. So just say preoperative, things you need to do before surgery, post-operative, things you need to do after surgery. What surgery can be performed under the muscle or above the muscle? Under the muscle, above the muscle. Breast augmentation, breast enlargements. You need to know what another name for umbilicus is. Umbilicus is navel, your belly button. Facelifts are most common in women and men over the age of 50. What surgery may give you a temporary itchy, tight scalp with an unnatural look in the early stages? Hair replacement surgery. And what surgery does an incision on the columella occur? Your columella is the bone in your nose, so that would be rhinoplasty. Okay, so another question that you are going to need to know is 5 surgeries covered by medical. So 5 surgeries covered by medical are like your medical insurance. Can be eye surgery, blepharoplasty. If you have really droopy eyelids and it's affecting your sight, then that can be covered. Ear surgery, otoplasty. Nose surgery, rhinoplasty. Male breast lifts are very common, especially with younger boys. If the person getting the surgery is getting it for self-confidence, or because they get made fun of, or because they're depressed because they don't look the same as other people do, then sometimes insurance will cover that for kids that are under 18. Female breast reduction or lift. Funny story, I know this woman who just had a breast reduction. She had large breasts, really large breasts, and it was giving her a bit of pain, but she just didn't like how her shirts fit. And I said, be careful, don't get them too small or you're going to be completely unhappy, because the smaller your breasts are, the more pronounced your stomach is. So anyway, they did take too much off. She's not happy. Now she's got this kind of smaller boobs and more of a belly, but it was covered by her medical insurance, so you can't really tell them how to do their job. But mental note that. So again, 5 surgeries covered by medical: eye surgery, ear surgery, nose, male breast reduction, female breast reduction / lift, and that's it. That's all you need to know for your quiz. So your quizzes, you can find those in your folders that Anna's made for you guys. Yes, you can do open book. I prefer you not to. Again, if you can do it on your own without looking, that would be great. Better for you. But obviously, open book is an option, and you won't be docked marks for that either. So good.
Izzy wants you to repeat the 5 surgeries.
Okay. Blepharoplasty, so eye surgery. Otoplasty, ear surgery. Rhinoplasty, nose surgery. Gynecomastia, male breast lift. And female breast reduction / lift. Yeah. Yeah, we're going to do questions again after the laser chapter. The laser chapter is actually going to be a little faster. We'll get through it a little quicker. So when I'm done the laser chapter, we'll go through and do question answers again. And then again tomorrow at 12, if you guys can log in then too. One more minute for questions, and then we'll move on to laser. Okay, moving on. Cosmetic laser surgery, the fight against aging skin. In recent years, lasers have shed their science fictional image to become a surgeon's and dermatologist's most promising weapon in the fight against aging skin. Laser resurfacing is a very controlled burning, highlight that, you'll need to know that. It's a controlled burning procedure during which a laser vaporizes superficial layers of facial skin. So it's just literally just burning off the superficial layers. Removing not only wrinkles and lines caused by sun damage and facial expressions, but also highlight, acne scars, some folds and creases around the nose and mouth, and even precancerous and benign superficial growths. In a sense, the laser procedure creates a fresh surface over which new skin can grow. So laser is ultimately just creating an injury. When you can create an injury on the skin, what happens underneath the skin? It fights back with collagen, it produces collagen to rebuild the structure of the skin again. And when that happens, it automatically gives you a more youthful, plumper skin. While the Food and Drug Administration does not regulate how surgeons carry out these procedures, it is responsible for clearing lasers for marketing for the user's request by the device's manufacturer. So it really is up to the manufacturer of how they want to market their product. Now, in Canada, there's no regulations on who uses lasers or what training you have before you can use a laser. So it's a really good idea as an esthetician now in Canada to start your own business or buy a laser machine and start offering it as a treatment, because there are no regulations. If you go to the United States, you have to take intensive training and you have to get a diploma and very expensive schooling in order to become qualified to even purchase a machine. But I don't know if not having regulations in Canada for that is a good thing or a bad thing, but if you're an opportunist, it's a good thing. So I think we talked about this before. If that's something you guys are thinking about, you want to do your own home business or start up your own clinic, doing laser resurfacing is a great thing. And you guys know that we're doing laser resurfacing at the school now, or we will be in the upcoming year for dark pigmentation spots, red spots, for lifting and firming. We'll be doing the IPL laser, which is really exciting. Lasers in cosmetic surgery. Since their 1958 discovery, lasers have become a powerful industrial tool, but their applications in medicine have been truly revolutionary. The lasers are used as surgical tools that can cut through tissue without causing excessive bleeding. So surgeons, instead of using a scalpel or a knife to do surgery, are using laser to cut through flesh. Less bleeding, and it coagulates and heals the injury right away. Stops bleeding. Also, for many internal procedures, surgeons can get the laser's energy to reach areas within the body more easily than with a scalpel. And finally, the wavelengths of the laser light itself lets surgeons use the device selectively on very specific types of tissue, like port wine stains, hair follicles, without affecting nearby tissue or surrounding tissues. But using lasers for facial skin resurfacing was discovered almost by accident in the course of treating acne scars with a laser. Surgeons noticed that after resurfacing the skin around the scar to make the scar less visible, small adjacent wrinkles were gently diminished. So lasers were originally used for scar reduction, and then they found out that it was great for wrinkles too. Resurfacing is very appealing to people because it is a way of refreshing the skin surface and getting a new layer of non-sun damaged and more youthful skin. So what happens is when you are doing laser resurfacing on the superficial layers of the skin, it's stimulating new layers of the skin to come up. So any damage in those layers is eventually going to lift up and crust off, and the new baby skin will be coming up and exposed to the elements. So yes, these laser treatments are amazing, but you have to be very careful with your new baby skin. You have to stay out of the sun, careful of pollution, extreme heat, extreme cold. Otherwise, you could actually cause more damage to the skin because it's more vulnerable to the environment. Collagen is a key fibrous protein in the skin's connective tissue, and it helps give the skin its texture. Natural aging and such factors such as sun damage and smoking help break down the collagen layer so that the skin's once smooth surface develops wrinkles. So wrinkles are caused by the breakdown in collagen. So as soon as that collagen is damaged, the skin almost like folds in because there's no plumping collagen molecules to keep it firm. So as soon as those collagen molecules decrease, the skin bloop, folds in on itself and creates a wrinkle. Laser resurfacing can often make patients look 10 to 20 years younger, and the results can last for 8 to 10 years. But after surgery, patients must avoid sunbathing and destroying their skin again. Like we discussed, patients can have repeat treatments after 1 year, but usually the first procedure is so successful, a follow-up is not needed. Now, there's different types of laser resurfacing treatments. There's very mild treatments like IPL, where you can go back to work the next day. Fractional, you're red, oozy, inflamed maybe for a day or two, maybe 3 days. But there are more intensive lasers where you have to be at home, out of direct sunlight for 2 to 3 weeks, and sometimes even bandaged, completely bandaged. So it just depends on the type of laser you're using. But obviously IPL lasers and fractional lasers are the most commonly used now because there's a lot less downtime and people can resume regular activities quite quickly. Lasers cannot rejuvenate skin on other parts of the body, nor can laser treatment lift or remove sagging jowls or smooth out crepey or saggy neck skin. These conditions only respond to traditional cut and stitch surgical methods. Especially in women, we always say that you can tell that women are aging in their neck before their face. So you always want to make sure that if you're getting these these laser treatments, you always include your neck as well as your face. It doesn't work for the sagging skin as much, but it still makes a difference. Now, not everyone makes an ideal candidate for laser resurfacing. Certain people with very sensitive skin cannot tolerate the medications and lubricants used on the skin during healing. The darker skinned ethnic groups are not candidates because the laser treatment alters the color of the skin too dramatically and unpredictably. There are lasers now that can be used with darker olive tones, brown tones, or black tones, but there are specific machines that you use for that. But in the hands of a very experienced surgeon, people with darker skin tones, although not ideal candidates, can benefit from the surgery. I think I told you guys months ago this story about laser hair removal. I had a male client, and he had a darker brown skin. He was an actor, and he saw me for facials and massage. And his skin, his whole back and chest, was all spotted with hypopigmentation and hyperpigmentation, like white, black, white, black, white, black, white, black. And I asked him why that happened or how that happened, and he said that his past esthetician, who he sued for misuse of her equipment, completely destroyed all of his dark brown pigmentation in his skin, and it turned it white. So he was going in for laser hair removal for just simple laser hair removal techniques, and she completely destroyed his melanin. So he ended up suing her. I don't know what happened. But he's like, yeah, he's an actor. So he's like, every time I'm on set or I go topless, he's like, the makeup artists have to color all the white spots in with makeup. So it's extra time, extra money, and it's, it was really bad for his career. So you have to, when you're buying these machines, especially if you're buying secondhand machines on Marketplace or Craigslist or whatever, you have to make sure of the proper training. Make sure you have the proper training manual, make sure you can get a hold of the manufacturer, and make sure that you know exactly how to use that equipment. But with laser hair removal for for the ideal purpose of hair removal. Newer machines are always the best way to go, so keep that in mind. People who are not mentally prepared for resurfacing or who expect instant results are not good candidates. Potential patients have to realize that there will be bruising, swelling, and they will be holed up in the house for 7 to 10 days. This is the more intense laser resurfacing. They will have crusty, oozy, bruised, scabbed, raw appearing face. Further, they should not expect unflawed skin, however, can expect a 50% or greater improvement. They must also plan on having at least 10 days of healing time before applying makeup. For satisfactory healing, that means following rigorous aftercare treatment, including proper skin cleansing, the application of skin lubricants, and the frequent changing of dressings if needed. Risks. As with any medical procedure, patients may experience certain complications, most temporary including a prolonged redness, tenderness, easy flushing, and some pigmentary changes like hyperpigmentation when the skin appears darker than normal. Other risks are more serious and possibly permanent, including hypopigmentation, so we talked about that, the lightening of the skin. Somewhere between 1 to 2 years after treatment, it becomes clear that there is a permanent lightening of the skin color where the resurfacing was done, so this doesn't even happen until years after the treatment. And scarring may occur in about 2% of the cases from poor post-operative care, during which time an infection may develop, or a surgeon may go too deep during the procedure, creating an injury the skin cannot repair. Laser removal for tattoos. A short pulse of intense laser energy is delivered by the Alexandrite laser that is selectively absorbed by the tattoo ink in the dermis of the skin. The energy fragments the tattoo ink, and the fragments are removed by your scavenger cells in your body. The ability of the laser to remove tattoos is dependent on many factors. Darker pigments such as black, blue, green absorb the laser energy well and are more responsive to laser. Yellow, red colors are less responsive. Amateur or self-made tattoos respond variably. Although amateur tattoos often have less ink, the ink is often deposited in different levels of the skin. Generally, all tattoos require several treatment sessions. There is some mild pain with the treatment. The pain has been described as similar to like the snapping of a rubber band on the skin. So I've heard that about laser hair removal. It just feels like a bunch of little rubber bands snapping and pinching on the skin. So it's not excruciating pain, but it is uncomfortable. Local anesthesia is often used, especially with larger tattoos. The laser may cause some temporary or even permanent lightening of the skin, and we call that hypopigmentation. The treatment may also cause minor texture changes to the skin. Okay, guys, that's it for that chapter. Let's just go over the questions. I'll read through the questions with you, and then at the end, we'll open it up and you guys can ask me questions. Okay, so number one, what is laser resurfacing and how does it work? It is a controlled burning of the superficial layers of the epidermis. It vaporizes superficial lines, deep wrinkles, crow's feet, acne scars, pigmentation damage, blackheads, and stimulates collagen. Number two, what are the benefits of using a laser instead of a knife or a scalpel? It cauterizes the blood while it cuts through the flesh, preventing bleeding. And it can also reach different areas of the body that are harder to get with a scalpel. Does your skin produce more collagen after a laser treatment? Absolutely, yes. What type of people are not good candidates for laser? People with darker skins or people who have no pigment in their hair. So for laser hair removal, for instance, the laser is attracted to the pigment, to the melanin in the hair, therefore being able to destroy it. If you have a blonde hair or a lighter hair, or even like a light red hair, the laser might not be attracted to it enough in order to destroy it. How many days of healing are to be expected before leaving the house or putting makeup on? So this also depends on the type of laser you're using. We know that you can resume regular activity after 1 day, but sometimes 10 days max with other lasers. So you can say 1 to 10 days. What will the skin look like immediately after treatment? Crusty, oozy, bruised, scabbed, raw appearing looking skin. 7, what are some serious and possible permanent risks of laser treatment? Prolonged redness, tenderness, easy flushing, pigmentation, hyper or hypopigmentation, scarring or infection. Number 8, how does laser work to remove tattoos? The laser is selectively absorbed by the tattoo ink in the dermal layer. The energy fragments and tattoo ink are removed by scavenger cells. So basically the laser breaks up the pigment into tiny little particles, tiny enough that your own scavenger cells in your body can digest them and remove them from the body. Number 9, is local anesthesia required for this treatment? Is it painful? You can use an anesthetic. You can use a topical anesthetic or an injectable, but it really depends on the person. Yes, certain laser treatments can be painful, but really all you need is a topical anesthetic. Anything more would be up to you and your doctor or your esthetician. Okay guys, your turn. Ask away. Yes, there's so many different uses for laser. Again, laser resurfacing, anti-aging, wrinkles, where it actually vaporizes the superficial layers of the outer layers of the skin. And yes, laser can be used for tattoos. It fragments and breaks down the pigment into tiny little fragments so the body's scavenger cells can remove them. And usually when that happens, it doesn't get all the pigment. So usually when people remove a tattoo, they still have a bit of pigment, like a lighter pigment. So they'll normally get a different tattoo on top of that to kind of cover that up. Contraindications. Contraindications of laser, any sensitive reactive skin, rosacea, eczema, psoriasis. Now in saying that, if you're having a rosacea flare-up, you cannot do laser on top of it. If you're not having a flare-up, then yes, you can do laser on top of that, but just know that that laser is going to act like a trigger. So if you're prone to rosacea flare-ups or eczema flare-ups, then having that aggressive treatment, laser treatment, may give you a flare-up. But if you're not inflamed and you don't have any broken skin, then you can do laser, absolutely. Open acne. Otherwise, there's not very many contraindications. Learning hair laser waxing, yeah, we don't, when we get our machine in, our IPL laser machine, it will do resurfacing on the face, firming, toning, wrinkle reduction, and it will also remove hair. Any more questions?
Will we be learning hair laser waxing? Do you have some already?
Yeah. Okay, guys, well, if we don't have any more questions, then that's all we need to focus on this week. Again, make sure you do your questions and just focus on completing that cosmetic surgery quiz. And really try to join me tomorrow for the Zoom at 12 o'clock so we can discuss more what you learned today.
What does it mean?
How long should a laser treatment last? It depends on what you're using it for and what part of the body you're doing it on. Say you're doing laser resurfacing for the face. It only takes about 20 minutes. The gun has certain areas that it treats, and it works in segments on the face, 15 to 20 minutes. If you do this segment, the neck to décolleté, again, 15 to 20 minutes. So if you're doing the face and the neck, I would probably say 45 to 60 minutes. Prep time, you just have to have a clean face, and then the technician will put gel, a thick layer of gel on the face before she goes ahead and does the laser treatment. It's pretty much the same for laser hair removal. It's quite quick. It's quite an easy procedure to administer. Now, how long should a laser treatment? Okay, and if you were asking me about how long the results should last, if you're having an IPL or a fractional laser treatment, it should last 6 to 12 months. So yeah, half a year to a full year. So you shouldn't have to go back and have IPL or fractional any sooner than 6 months, generally speaking. Can people with cancer receive a laser treatment? No, people with cancer cannot. People with cancer can't really do any type of invasive treatment, including electrotherapy and facials, unless they're in remission. If they're in remission, then it's fine. Pregnant women, yes. After the first trimester, after 3 months of pregnancy, they can have laser, yes. Yeah, and again, Mara, with pregnant women, it's just suggested to stay away from anything having to do with electricity, just like our high frequency in our facials, our direct current in our facials, laser resurfacing. It's just better as a whole to stay away from those types of treatments. But yeah. Okay, guys, this has been so fun. I'm glad I got to spend some time with you. I started to really miss you. So I'm glad that we're connected again, and I really look forward to talking with you again tomorrow. If not, via email and Facebook chat. And we're going to be doing this again next week. So have a great day.